one.
My name is Brooklyn Ballard, and I am first going to verify the patient healthcare provider order. So we have a patient, Mr. Ren Harami. He is a male. Date of birth is 3/3/83. Patient ID number is 160011180. He has been admitted after a motor vehicle accident with a suspected broken pelvis. He will need a double lumen catheter inserted right away before he goes to x-ray. The physician orders an anchor retention catheter to a dependent drainage system before he goes to x-ray, and the order says to insert the retention catheter to a dependent drainage as ordered for a male client. First, we are going to wash our hands. Then I'm going to gather up all my supplies. So I have my healthcare provider order. I have my non-latex sterile gloves that are sterile, unopened, intact, and unexpired. I have my clean gloves. I have my sterile catheterization kit, and it is unopened, intact, and unexpired, and it is sterile. And I have my 3 clean washcloths, and I have my basin filled with warm water and soap. So I'm just gonna get all that together, and we're gonna go into the patient's room. So I'm gonna knock. Hello, my name is Brooklyn. I'm gonna be your student nurse today. I'm gonna wash my hands, and I'm gonna pull for privacy. And I'm gonna ask, how are you doing today? And he says, good. So can you tell me your name and date of birth? He says Ren Harami. Date of birth is 3/3/83. Okay, so next what I'm going to do is I'm going to go ahead and I'm going to compare the patient's ID patient's ID band against the healthcare provider order. So the patient's name on the patient ID band is Ren Harami, and the patient's name is Ren Harami on the healthcare provider order. The date of birth on the patient ID band is 3/3/83. The date of birth on the healthcare provider order is 3/3/83. The patient ID number on the patient's ID band is 160011180, and the patient ID number on the healthcare provider order is 160011180. So they all match, so therefore it's okay to proceed. So first, I'm going to explain the procedure. So today we're going to be inserting a retention catheter to the dependent drainage. Is that okay with you? And he says yes, so therefore it's okay to go on. Okay, can you tell me where you are? And he says the UK College of Nursing building. Can you tell me what day it is? And he says Tuesday. Can you tell me what month is coming up next? And he says April. So the patient is alert oriented ×3. And are you allergic to betadine or latex? And he says no. So therefore it's okay to go on. So first what I'm going to do is I am going to raise the bed up to the appropriate level, and I'm going to lower the sob rail that is closest to me. And next what I'm going to do is I'm just going to come over here and I'm going to wash my hands again, and I'm going to get 2 clean pair of gloves. And first what I'm going to do is I'm going to assess the patient for urinary retention, and I will do this by percussing and palpating the bladder. Another way you can do this is by using a bladder scanner, but today we're going to percuss and palpate the bladder. So we're going to percuss, and then we're going to palpate the bladder. Okay, and I did notice that there was some dullness upon percussion, and whenever we palpated, we were looking for urinary retention, and so therefore we were going to go ahead and continue with the procedure. So now I'm going to remove my gloves. I'm going to wash my hands. Okay, next what I'm going to do is I'm going to get another clean pair of gloves, and we are going to assess to see if the patient needs any pericare done before the procedure. So we now have our gloves on, so we're going to assess, and the patient does need some pericare to be done before the procedure. So we're going to get our basin full of warm water and soap and our clean towels. Okay, and if the male was uncircumcised, we would retract the foreskin, and we would leave it retracted while doing the pericare, and then while we do the procedure, and then after the pericare, after the procedure, and then we would return the foreskin back to its original position. So now we're going to go ahead and we're going to clean the penis. So we get our towel and warm soap water, and we're going to clean around the head of the penis in a circular motion. We're going to get a different part of our rag, clean around the shaft of the penis in a circular motion, and then we're going to clean around, up and around the scrotum in a circular motion with a different part of our rag, and then we're going to discard that. Then we're going to rinse with warm water. We're going to clean around the head of the penis in a circular motion, different part of our rag. We're going to clean around the shaft of the penis in a circular motion, and then we're going to go around the scrotum in a circular position with a new part of the rag. And then we will pat dry if needed. Then we're going to remove our gloves, and we're going to wash our hands. Okay, next we're going to go ahead and get our catheter kit tray ready to go. Alright, so we're going to go ahead and open up the kit, and we're going to go and open away from us first. And then we're going to open to the side of us first, and then to the other side of us first, and then down. Okay, now that we have our sterile field open, we are now going to go and put on our sterile gloves, but while doing this, we're going to keep our sterile field in the line of my vision. So I'm going to step over here and keep the sterile field in my line of vision. I'm also going to, when I put the sterile gloves on, I'm going to make sure that it is done above my waist. So we're going to go ahead and open up my sterile gloves, again keeping the sterile field in my line of vision. So we're going to go ahead and open the sterile gloves. We're going to pick up the cuff, hold it above our waist. Go ahead and put on our gloves. Then we're going to pick the second cuff up, and we're going to make sure that we keep our thumb out and don't let it touch it. So we're going to pick up our second cuff, hold it above our waist, put on our gloves, use our elbow, swipe it down. We're going to keep above our waist. And so now I'm just going to go ahead and get anything that I don't need out from the sterile field. So I don't need these gloves, so I'm going to go out and away. I don't need this, so I'm going to go out and away. And now I'm going to go ahead and get my drape ready. And I'm going to put the clear side down, or the shiny side down. And we're going to go here, and we're not going to cross over our sterile field. We're going to go out, and then we're going to let go. Okay, and now we're going to go ahead, and I'm going to get my tray out and get that situated. Okay, and first I'm going to put the betadine onto the cotton balls, and then we're going to go out and away from the sterile field. And then we are going to, while I have two sterile hands, I am going to go ahead and lubricate my catheter tube. So I'm going to open up my lubricant, and then I'm not going to cross over my sterile field. And I'm going to go ahead and lubricate my catheter. I'm not going to go more than 2 inches from the tip. Okay, then we're just going to go ahead and let the catheter sit there until we're ready. And we're going to go out and away from the sterile field. Then I'm going to go ahead and attach my syringe to the catheter. I'm going to remove my cap. So we're going to go out and away from the sterile film. Then we're going to go ahead and attach our syringe there. So that's ready to go. Okay, and next what I'm going to do is I'm going to go ahead and use my non-dominant hand, and I'm going to grasp the penis at a 90-degree angle. I'm going to pick up my forceps, and I'm going to use my cotton balls that are covered in betadine to clean the urethra meatus. And we're going to clean the urethra meatus in a circular motion. Then we're going to go out and away. We're then going to clean the up above it just a little bit, around in the circular motion, out and away. And then if we need to remove any excess, we can go around and then out and away. And we no longer need these anymore, so we're gonna go out and away. And I'm just gonna go ahead and get my tray out of my way. So we're gonna go out and away. Okay, and then I'm just gonna go ahead and position this a little bit closer. Again, we have the penis at a 90-degree angle, and whenever we insert the catheter, we're going to instruct the patient to take a deep breath. And whenever I grab the catheter, I'm going to grab it no more than 2 inches away, 2 inches from the tip. So now we are going to go ahead and we are going to instruct the patient to take a deep breath. And while doing this, we're going to make sure that we do not touch our sterile hand against the penis. So we're going to now go ahead and insert. And we're going to go all the way up to the wide fabrication. And once we're there, we're going to stabilize that. And then we're going to go ahead and inflate our balloon all the way. Okay, and then once we do that, we're then going to pull all in one motion to the foot of the bed until our balloon catches. And then we can go ahead and remove our syringe. I'm going to go out and away. And then we can go ahead and take this and remove all of our garbage that we need to the end of the bed. We can lay this on the bed now. I'm now going to remove my sterile gloves. And I'm going to wash my hands. And I'm now going to put on a clean pair of gloves. And I am going to perform pericare just as I did before, except this time I am going to remove any of the, I'm going to perform the pericare just as I did before, but I'm going to take, this time I'm going to clean all the way down the catheter, removing any irritants, such as the betadine or the lubricant, and then we would then be able to return the foreskin back to its original position. And then now what I'm going to do is I'm going to go ahead and I'm going to tape the catheter to the patient's leg, and I'm going to make sure that there is no straining when doing this. I'm going to make sure that it's not pulling, or it's not too tight. And then if we were in a regular hospital bed, I would attach the bag to a non-movable part of the bed. And when doing this, we're going to make sure that we keep the bag at all times below the bladder. Okay, so now that we have that done, I'm going to remove my gloves. I'm gonna wash my hands. And then I am going to raise up the side rail that's closest to me, and I'm gonna lower the bed back down to its original position. I will make sure the patient is comfortable. And now I'm going to document. Okay, so I'm first going to state that the urine is a pale yellow color. And then I'm going to say that the urine output, it was at 150 milliliters. And the patient well tolerated throughout the procedure, well tolerated the catheterization throughout the procedure. And then I'm going to say that there was no foul smelling odor. and then I would date it. I'm gonna put the time. And then I'm going to initial. Okay, and then here's my documentation.